You're welcome to another episode of Surviving COVID-19, an online series seeking to sustain advocacy on what citizens should be doing to keep themselves safe so we can all survive the coronavirus pandemic visited upon us from nowhere. The pandemic has come at a great cost to everyone. Virtually everyone has been affected. Schools have been closed, jobs have been lost, families and friends have been separated by the closure of borders, while some have not been so fortunate and have died at becoming infected. Businesses have collapsed while economies have been brought to their knees, mainly because of restrictions imposed in a bid to stop the spread of the virus. Ghana, like many other countries, also took steps to check the spread of the virus, including a lockdown which lasted a few weeks and restrictions which have kept many school children at home without access to academic work for months. Generally, Ghana was applauded for its initial response to the pandemic. On the back of the famous quote by the president, "We know how to bring the economy back to life. What we don't know is how to bring people back to life." Government decided to take up water bills and meet us halfway as far as our electricity bills are concerned. Just so we as a people can continue to live our lives despite the pandemic, government introduced some measures, including the wearing of face masks and maintaining social physical distances. In the last few weeks, there's been a decline in the active COVID-19 case count in Ghana, which government says is an indication that we're gradually getting a grip on the situation. Indeed, the health workers have confirmed that they have less COVID-19 patients to treat. There are those, however, who don't believe that a decline in active cases has anything to do with the efficient manner in which we as a country have managed the situation. For them, the authorities in charge are only painting for us a picture of the situation they want us to see, when really the situation is getting worse on the ground. Today's session will seek to ask a few questions. What has been the real cost, social and economic, of the measures we took as a country to contain the pandemic? Considering the fact that we had a half-hearted approach to our measures, that is, having a partial lockdown and not following through with all that we were supposed to do to complement the lockdown, was it really worth it? Have the other restrictions been also worthwhile, considering the compliance with protocols have been rather lax in recent times because everyone thinks the virus is gone or not as dangerous as we thought? Others too argue that even though COVID-19 has killed some 231 people in Ghana in the last 5 months, there are diseases that have killed many more, and yet we haven't taken actions and measures which have cost the nation that much. So is COVID-19 worth all the attention? At the end of the day, yes, COVID-19 is deadly, but far less deadly compared with other countries where it's the worst they've seen in recent years. So if COVID-19 is impacting us differently, should we be thinking up homegrown solutions or Africa-specific prescriptions instead of taking hook, line, sinker what the rest of the world is doing? Especially because unlike other countries that are advanced, where you will get benefits from the state if you lose your job or remain unemployed because of a lockdown or COVID-19 restrictions, you're on your own if you happen to be in that situation in Ghana or in many other African countries. So at this point where it appears, or as the authorities will have us believe, that the pandemic is getting under control, or as some say, we've completely lost the fight, can we come to some consensus on what we should do to get our lives and the economy back on track, seeing that we will have to live with the virus? Should we decide that everyone should wear a mask and wash their hands and sanitize regularly? Can we focus on that and enforce it strictly so that we can ease all the other restrictions and let our children return to school? This will be the focus of the conversation today. Before then, though, can we get to understand where we are now as a country as far as our COVID-19 response is concerned? Are we testing as much as we should? If not, why not? Is the pandemic really under control? And if so, on what basis do we say so? How about the samples sent to the labs for testing from Wa and Bogatanga and other places, as reported by Joy News correspondents, which are not forthcoming? Dr. Franklin Isiru-Bekwe is the head of disease surveillance at the Ghana Health Service. So, thank you for making time to speak with us. Please tell us, where we are as a country as far as the COVID-19 pandemic is concerned?
Israel, let me say that Ghana's trajectory as an outbreak is along a wave. So if you look at our epidemic curve, you can see that we have two waves. It's a smaller wave, which like started around 12th of March when we started having our first two cases. And that wave goes up and you realize that somewhere around like 19th or 7th of May, that wave appears to go down. And then there's another big wave that maximizes somewhere around end of June. And then it appears, and for the past like 2 weeks, you realize that that wave is going down and down. So for us, if you talk about Western Europe, we are talking about entering their second wave. But ours, you can see two waves. But now, we won't say that the wave has ended because COVID has a long lifespan. So I would say that we are in our second wave. It appears to be going down. So that's where we have now. And if you clearly want to look at the key variables, let me say that in counting the cases in Ghana, we initially started with what we call the case definitions. So there are people who go to the hospital and they will have fever, they have a cough, they have a sore throat, they have respiratory symptoms. So you will say that these are suspected cases because they will meet our case definition. And then these people will be sent to the hospital and then they will have a test done. At the initial stages, it was being done in the Gucci and then KCCR. So those were our initial collection of cases or cases being identified, purely based on case definition. And then with time, we realized that let's expand our scope to have an idea of the extent of spread. So we now introduced what we call the enhanced contact tracing. So these are people who don't typically show symptoms, but they are said to have the infection. So typically, if you have an outbreak, you have what we call an epidemic curve. So it's about drawing the number of cases about based on time of onset of symptoms. But then because we are using this enhanced system, whereby people are not using, they are not having symptoms. So if you look at our maps, you can see two layers. The first layer, which is purely based on, let's say, symptoms, and another layer, which is the big one, based on asymptomatic cases. So that has been the trajectory of our outbreak for now. And initially, it used to be more dominance of those from the enhanced contact tracing, but for now, it's about 50-50. So I would say that Ghana has an outbreak that has two waves, a smaller wave and a big wave, which is going down for the past 2-3 weeks.
You talk about the wave going down for the past 2-3 weeks. Is it the case that the wave is actually going down, or it's the case that we're not testing as much? You've actually conceded that on the same show, that we are not testing as much. Isn't that really what the problem is? That because we're not testing as much, the cases are not coming out, or we're not finding the cases?
No, we are testing as much as possible. You see, what is happening is that I try to explain that the essence of, let's say, getting the best for your system is people not getting ill or not dying. So in the early stage of an outbreak, you set up a surveillance system to pick those who are ill. And then you want to also have an idea of the extent of spread or infection. So that's why we put in place that enhanced contact tracing. But that has been established already. So now, what we're doing now is that which people are ill that we need to clearly focus on, and then who are their contacts. So our focus now is about the cases who are ill in their contacts. So it's not that we are not testing, we are testing. And clearly, if you look at the figures that exist in the hospitals, you can see that there's a clear decline in the number of cases reported. So if the people who are ill, if they are going to the hospital, you are not going to the hospital. So clearly tells you that the number of people who are ill is also going down.
All right. So we know that, but we also know that there are people who are in hospital as suspected cases. and whose samples have been taken, but their results are not coming. So if you say you're focusing on the people who are ill, we're still not testing those people as per the reports that we have.
You see, let me say that when we started the response, we had two laboratories in the country. It was Noguchi in Accra and KCCI in Kumasi. And then to be able to sustain our large testing, we expanded the testing capacity. And so as I speak now, I think we have about 14 labs in country, spread from southern Ghana to northern Ghana. Northern Ghana alone has, I think, 3 laboratories. And then middle has quite a number, and Greater Accra, I think, has about 4. So the capacity to test exists. So there might be some few instances that we have a challenge of not getting. But now the issue about testing, and let me be clear, our main focus is to see who is ill. So that's why we are now looking for the suspected cases to make sure that they are tested. So it's unfortunate there will be few lapses, but there was also an issue about backlog. And that backlog, as far as we are concerned, has been cleared. So maybe there may be a few pockets of cases that has not been exhausted. But now we don't have that obvious challenge that occurred about 3 weeks ago.
The reports we're getting suggest that each week they send the samples. And even this past week, they've sent samples. They have been waiting for the results for weeks, and they're not getting the results. And they have the patients or suspected cases in the hospitals. So it's not a situation of, well, a few backlogs that have not been cleared or a few cases. And we're talking about the Upper West region and we're talking about the Upper East region. These are 2 regions that, according to the Ghana Health Service, there are 0 active cases. If there are 0 active cases, but there are samples that have not been tested, can we really say that we don't really have any cases there?
Okay, thank you for bringing it to my notice, but I think that I will immediately get in touch with the regional director, because let me be clear, for Northern Ghana, we have the Pong Tamale lab, which is more of the veterinary lab, which is also part of the response. They have the public health reference lab, which is situated in Tamale. So these 2 labs, they were actually even trained by my team last or 2 weeks ago on how to use electronic reporting. And we didn't have report of a backlog, but I will not dispute your issues. We'll find out what is the issue, because clearly the northern part of Ghana doesn't have a lot of cases being reported as compared to, let's say, Greater Accra. So we'll find out what is it that is happening that they are not testing, because a chunk of the cases that we are having in Ghana is actually coming from Accra and Kumasi. So we'll find out what is the challenging situation in Northern Ghana. And let me also, we are even adding Navrongo as a testing site. So clearly, if you have Navrongo, you have Pong Tamale, and you have Tamale, I'm so struggling that we have challenges. But we'll find out what is the unique situation.
A bit more on the Upper West and Upper East regions. Our correspondent who we spoke to, who had actually gotten in touch with the health workers and the sources there, tell him that they have been sending hundreds of samples to Tamale. Now, the hundreds of samples, if you're looking at and if you're going by what you're saying, which is you're interested in the people who are ill. So these people who are ill have gone to the hospital, and so they've taken their samples. They've sent hundreds of samples to Tamale. And going by the positivity rates that are coming up, it's likely that we're going to have, a significant number of these people tested positive. But if we're not returning the samples, the results, then these people will also be in the communities and keep spreading the virus.
Yes, okay. Thank you very much. Let me say that we haven't stopped, let's say, doing enhanced contact tracing. If it's about 100, then it's possible that they are doing maybe a bit of mass screening. So, but we need to get into the details of what is being reported. But we also want to be sure what samples are being transported, because the reference lab doesn't only do COVID. They do measles, they do meningitis. So we have to be sure what samples are they sending there. And
This
so
is,
maybe
these are
sure
COVID
it's
samples.
fine. And what I'm saying is that we'll find out what is the situation. Do they have a unique challenge that we need to address? Because we get results from all the testing sites on a daily basis and we report. And we haven't had any unique situation that they are not reporting.
Now, you've also indicated already that the Ghana Health Service is more interested or is focusing on people who are ill. But there may be people who are asymptomatic or mildly symptomatic with the virus. And if the Ghana Health Service is not interested in these people, the people will go about still spreading the virus. And if they're spreading the virus, then we're likely to have these people infecting others who may not be so lucky, who will become ill, and then we're going to have people thronging the hospital, a lot more people who are unwell thronging the hospital. Is this the right strategy, or is this a strategy you really want to follow through, or you think is really prudent?
No, what I'm saying is that we still go on to test others, but I mentioned that the priority is suspected cases. The priority is contact of confirmed cases. The priority is exposed students, exposed health workers, returnees. But it's not that we are not testing. No, that's not what we are talking about. So far as we look at our trace groups, they are brought on board. Just a few weeks ago, there's a lot of tests that was done in Tyne district because they think that some people have been exposed. So we are not restricting ourselves to only people who are symptomatic. But what we are saying is that we want to be sure that we get an idea of the situation in the country. But in managing the response, it's not in isolation. You know, when you talk about, let's say, a disease like HIV, there's an assumption that your sex partner must be assumed to be HIV positive. So wear a condom. Do you understand? Likewise, assume that the person who is 1 meter from you could be COVID positive. So wear a face mask. So you don't need to be assuming that people around you are COVID negative. So don't wear a face mask. So it's a composite approach to response. And we are saying that let's work together. And so let's not decide that this guy's face looks like COVID negative and not wear a face mask. So we cannot test everybody in the country. And let me say that your status is dependent on when the test was done. Like as we sit here today is 16th. When they do the test and they say I'm negative for only 16th. 17th, I cannot be negative. So we cannot test everybody on a daily basis to be sure of our status. That's why we are saying that assume that the people around you could be positive and wear a face mask. That's the direction I think we need to have. You cannot continue to test everybody in the country.
And now, still on the regions with zero active cases, Upper West, Upper East, and a few others, Savannah, I believe. Now, we have given them the impression that there are zero active cases or there are no COVID cases, active COVID cases in their regions. And apparently, it is sending the wrong signal to the people there. Our checks again suggest that people are not observing the protocols. The face mask is completely out or it's barely visible in these places. They talk about the fact that if you see 50 people on the streets, you have just about one person wearing a face mask. Are we not sending the wrong signals to these people, especially when there are some suspected cases in these places, but we haven't returned the results and confirmed?
Okay, thank you very much. Let me say that where we are as a country in terms of response is a synergy between people like you, the media, people in the health system, and the population. So if any of these key actors is not playing the key role, where we are in a situation will go down. What we are saying is that the people or the situation being better is because there's a less exposure and also dependent on people somehow adhering to the protocols. So if any of these factors is not optimal, you're going to go down. So we just had a meeting last week with the DG had a meeting with all the regional directors that one sure way you are going to be measuring our response is to have kind of a weekly assessment of use of face masks, because it's one sure way to be sure whether people are actually adhering to the protocols. And the face mask is one critical ingredient of individuals' perception of risk. So if you keep on measuring it, it will give you an idea how people are conforming. And let me be clear, people ascertain risk based on what is around them. So we keep on pushing that let's wear the face mask. But it's a process. And people like you, the media, when we push the agenda, people will buy into it. That to remain COVID-free, it means that you need to be abiding by the protocols. So we encourage all of us to be in that network. The government is providing the enabling environment. The individual also has a role to play. The media also has to enhance the message that COVID is not off yet. So we all need to be abiding by the protocols.
So, Doc, you're saying that COVID is not off yet, but we have given the people in some of these regions the indication that things are fine. If there are zero active cases, people will just conclude that there's no COVID. And that is the message I believe we may have inadvertently sent to these people.
No, you see, COVID is a very fluid disease. You don't remain zero forever. It's dependent on the exposure. So you can be zero, and somebody can come from any place like Accra or Kumasi, and as far as immediately it comes there, that is introducing a case. So your status of being zero is not permanent. It's dependent on a certain set of conditions being maintained. So we are not. It's a kind of encouragement to people in such localities, but we are still pushing the right kind of message that make sure that you are wearing the face mask. And for us, that's going to be our key message. Where use of the face mask is going to be the key message, because that's a critical non-pharmaceutical intervention to solve COVID.
Let's come back to the issue of testing again. So I've been tracking the number of tests we've been doing in the last few weeks. And it's clear that we have dropped our testing significantly. Now, what is our testing capacity?
Okay, somewhere, Ghana is one of the few countries that started doing polling. And the polling is actually based on an assumption that you have a very low positivity rate. So when you collect a large sample of cases, it's likely that they'll all be negative. So in that context, at that time we had a capacity of around 8,000. But then when we started having high positivity, in that case, when you pool, you don't normally succeed. In that case, you have to unpool. So now we are doing more of unpooling, and that takes a long period of time to get a test done. Do you get it? So now, though we have increasing number of testing sites, the capacity to test has gone down a bit. Do you get it? But to us, if you look at our approach, which is going on, that we are focusing on our priority cases, it shouldn't be much of a bother. Because let me be clear, in time past, you can have like a company bringing about 500,000 of their workers, all because one person has been exposed. All those things were clogging the system. And let me be clear that your status of COVID is daily based. So you don't need to be doing daily testing. What you need to be doing is adhering to the protocols. And I think that message must sink to the average Ghanaian. Because you cannot test 30 million people on a daily basis to be assured that you are COVID-free. What is most important is abiding by the safety protocols.
Now, even if we're focusing, and you keep on reiterating the fact that we're giving priority to cases, people who are ill, but even if we're focusing on that, the last update we had what? Upwards of 42,000 confirmed cases. At the time when we had much fewer cases, we were doing a significant number of tests. And I'm not actually talking about those days when you were doing, aggressive out there. But if we're having even 147 people for 147 new cases, we should be having tests, I believe, in the region of maybe 20 times that. because they're likely to have interacted with a significant number of people. So why are we running tests of just about 1,000, thereabout 1,200?
Now, you see, so in the earlier one, we were looking at, because we are looking at a large number of people who were not at the same level of risk, you need to do more tests to get a number X. But now we are looking clearly at people who are at high risk. These are people who are symptomatic. So to get that same number X, you do less number of tests. I mean, that's the logic. Because
yeah, but
let me be clear.
If we're doing less number of tests, or we're deciding to focus on a certain priority, we're leaving out a certain pool of people who may also have been infected, but then we're ignoring them, and yet they'll go about infecting others.
Now, so who are those people?
So you're saying that we're focusing on people who are ill, and not so much on people who are...
No. Let me explain. Let me explain. We have categorized our testing priority. Now, one are suspected cases. These are people who have symptoms and go to hospital. Then we have two, contacts of confirmed cases. You get this? So that's the contact tracing which is done. Then three, you have exposed health workers, four, exposed students, so returnees, and all these tests are being done. So what is missing is the thousands and 2,000s of people in the companies who are just wanting to know their status. And as I said, I want to put it across that in that case, you need to be doing the daily test, because the fact that you are one guy in your company is possible doesn't mean you should test everybody in your FM, because even the status, the results are just for that day.
Is our COVID response being frustrated by lack of funding?
No. Let me be clear that I've been in the service for some time now, and this is one response, that it is largely government funded. It's dominantly government funded. So the interventions and prescriptions are from the central government. The partners are supporting, but so decisions that we are taking are actually homegrown decisions, and I think that funding is not a challenge. If you look at the initial, let's say, challenges that were coming about PPs, as much as possible, interventions have been brought on board, more involvement. That clearly now you cannot say that funding is a challenge. But we will not say that we have exhausted all. And let me be clear that we just had a revision of our plan, because to us, COVID has come to stay. You need to make sure that you are all focused in all thematic areas to make sure that disease doesn't disrupt your country.
I asked because we had a report from the Kajebi district where they're saying that they're financially constrained, and as a result, it was actually on the news, and as a result, they're appealing to people to come and support them. They're saying that because they're financially constrained, they get people calling them to report that they have suspected cases, but sometimes they can't even go and pick samples, or they can't transport the samples to where they need to transport them for the test to be done.
No, I think that I won't dispute that, because you cannot have a whole system. And as far as I'm concerned, we have a plan that on a quarterly basis or base funds are being released to the regions and to the districts. But you may have peculiar situations whereby districts or regions will exhaust their funding much earlier than is planned. And I think that in that case, you need to put in the request. You need to put in the request so that the central government. But let me say that that's why we are reviewing our plan, because the response is getting longer than anticipated. So clearly, I think that's why we very much appreciate the support coming from the private sector. A lot of agencies and partners have actually brought their support on board, and we will encourage all to actually support the response.
Now, talking about the stats that have been putting out, the people who say that there seem to be too many, inaccuracies and mistakes with the information that is put out on the COVID-19 website. And one of them I noticed recently, or some discrepancy, which I noticed, which I'd like to bring to your attention. So on the summaries right now, if you go on the COVID-19 website, you have 231 deaths so far. But then if you look at the details of the of the deaths, you actually have 232 deaths. Why do we have that discrepancy?
So we provided more information than the summary. So we will actually update that.
All right, so then people who look at some of these things and say that the Ghana Health Service is managing the information or withholding information.
No. Because as I told you, we try to verify to be sure that you see, that's why at the national level, as I said, we try to make sure we have all these variables filled in before we actually release them. And we just had a meeting about 3 weeks ago with the team in Ashanti region, because you see, at times the definition of COVID death at times is a bit challenging, and you try to ask yourself, is it really a COVID death? So the WHO tries to give some leeway, but for now we are saying that anybody who tests positive and dies, to us we call it COVID-related death. In some instances, it may be challenging. And let me say, Ghana is one of the few countries that we provide so much information which we don't normally are not supposed to be provided. Because if you look at some of the details about people having like retroviral infection, we are trying to send a message that it's not necessarily the COVID that can kill you, but there are other factors that can kill you. So we try to help you to actually overcome death. So that's what we try to do, but we don't suppress the information. But as far as I'm concerned, when the data comes from a region, we try to look at it and then update it.
All right. Now, joining me later on for the conversation, I have two other people who will be joining me for the conversation. Three, sorry. So one of them, because you're going to be available to join the live panel, I asked them to send in their questions. One of them sent in this question. Nana Kofi Quakyi is a Master of Public Health Research Fellow, doctoral candidate, and adjunct assistant professor at NYU School of Global Health. He asked, what is our current maximum daily capacity for testing, and what are the current preconditions for clinical testing? I know that you have answered a part of it in a way, but I'd like you to be more specific. What's the current maximum daily capacity for testing?
I think I tried answering earlier on before this.
But you didn't give a specific.
Yes, as I said, initially it was about 8,000 when we were doing the pooling. And now that we are doing this single testing, could be half, because we just had additional labs coming on board. So we need to actually speak to the lab. There's a lab network. They can actually update us about their full capacity. But what I'm giving you was when we were doing the pooling and they had about 8 labs, it was doing about 8,000. But now that they are doing single capacity, I'm not very sure of the numbers. It could be about half or a quarter of it.
Right, and he asked a second question, and but the other part of the question has to do with current preconditions for clinical testing, which you answered in a way. You're saying that you're focusing or prioritizing on the people who are unwell. Is that correct?
So clearly, I try to put you in that category. So for us, somebody goes to a hospital and then presents with the fever, cough, sore throat, difficulty in breathing, we have anosmia, and then the doctor says, oh, could this be COVID? So in that case, they suspect and they test sample. And then the other one could be people who are contact or confirmed cases that we also test. And then you have instances of health workers who have been exposed or students who have been exposed. And then we have this, Ghana is closed we have our borders closed, but we have a few returnees and we test them. So those are a category of persons that we are prioritizing our testing on.
All right. Then the second question he asked, can you please explain what goes into the review process for COVID-19 deaths and why it is taking 2+ months to confirm some fatalities? And then how many suspected coronavirus deaths are pending in the review backlog? So again, here you attempted to answer, but he goes on to ask that how many, if you're talking about the review process, how many deaths are pending in the review backlog?
Now, I think that one is actually dependent on the region, because the region have their own committee that looks at the cases and tries to ascertain whether it's a COVID death. So I think, as I said, we had a meeting about 3 weeks ago. It was actually called by the CEO of Confanoti. He chaired the meeting together with the regional director and the team. So they look at it. Are all these cases COVID? And when they are confident, they give us the list and they will update. So national normally doesn't. What we do is to make sure that you are able to update us with all these variables that are listed: age, sex, date of death, comorbidity, date of sample taken. Because we want to be sure that is it COVID. I mean, when was the sample taken? So those are the things that we collect from national. We don't really do much to just tabulate the data.
How long does it take from when for this review process?
It depends. You see, initially, when we're having less cases, we have what we call the case. You see, for this response, there are several thematic areas. You have the surveillance thematic area, case management, risk communication, logistics. So what we were doing was that the case management committee or group, they also sit and look at the cases that have come together as COVID, and they look at it and they ascertain and they give us the numbers that we have looked at these cases from the regions and we are okay, and they give it to us to tablet. So it varies, but now the regions have been doing that. So there's very little of the national level reviewing the cases. Is that when the region is okay, they give it to us and we update.
So essentially, the region is where the lag happens.
Yes, for now they are in charge of their review committee. They look at it and say, "Is this COVID death?" And then they send it to us. And then so far as we are concerned, we just upload.
All right. So we should be expecting that we are likely. So it's likely that we would have had a number of deaths, but we're yet to report them at the national level.
Yes. So when they can come with a batch, because it takes them some time to be convinced that these are COVID related, and they give it to us. So that's why we can upload about 9. If you look at our uploads, don't come daily. It comes in batches based on how they are convinced that these are COVID related, and then we upload them.
All right. Now, the other part of this conversation has to do with looking at all that has happened and where we started with our COVID response and where we are now. Would you say we have, and when we started very well. We locked we shut our borders, and we were doing aggressive contact tracing. The president indicated that we're going to go all the way and do all that we can to make sure we contain this. And we got a lot of praise, or we earned a lot of praise back then. Would you say that we have followed through, or we have relaxed, or lost our guard?
No. I don't think that. You see, clearly you can see that there has been a big improvement. The idea is to have sustained systems. So first, are we detecting cases? That is, are we applying case definitions? Are the hospitals picking cases? And the answer is yes. You go to hospitals, the doctors are there, and when you make the case definition, they pick your sample, send you a lab. So that is being done. What I would say has gone down is that large community testing. And I want to stress that is not the precursor to cut COVID outbreaks. What I want to stress is that assume that the people around you are COVID wear your mask, because the testing cannot be sustained on a daily basis. I mean, I have tested. Doesn't mean I should be testing every day. So that's for that aspect. I think we need to look at it. What we need and what we are focusing on is effective contact tracing. The persons who have been exposed to confirmed cases need to be followed through the 14 days and tested. And that is one key way we think that it breaks the transmission, not that mass testing. The initial idea was to understand the extent of community spread. Now we have the understanding already. So why do you still want to keep around testing everybody in the community? I don't think that should be the direction. Then the issue about availability of health facilities. Initially, when we started, it was Emma and Rich, and they had a capacity of about 14 beds. Now, I think we have over 500 beds across the country, and even luckily, the private sector has been provided accommodation. So clearly, you can see that there's an improvement in terms of availability of spaces for people to be isolated. So that has also seen an improvement. And then, as I said, the lab, we started with 2, now we have over 14. We even have 3 private people who have come on board. So you can see that there's an improvement, and it's about sustaining the health systems. And I think that gradually we are on course. But this is a very long haul outbreak, and it has its own challenges, which we are trying to address as we progress.
I want to start with you, Nana Kofi Quakyi. Do you have your questions, or did you get the answers that you were looking for from Dr. Quakyi?
Okay, thank you, and pleasure meeting all the rest of the panelists. Thank you for having me. Good morning to the other panelists. Pleasure to be here, pleasure to meet you. The 2 questions I asked that I put forward to Dr. Sarbah were really based on 2 separate issues that I think we have to get some perspective on COVID-19 management. The first of them had to do with testing. And I asked that question because I wanted to get a sense of why over the last few weeks, we've seen such a precipitous decline in the number of tests we're doing. And I asked that because it's important to contextualize what we're seeing in the trend in new infections. We're seeing that, over the last, 2 weeks, really, we're down to about 120 to about 200 cases a day, depending on which day it is. And that's down from days in late July, where we were confirming as many as 800, sometimes 900 cases a day. Now, that data, that drop is something we need to understand, because it's a question of whether or not we are actually detecting fewer cases, or whether or not we are finding fewer because we are testing less. And it's important we get that distinction clear, because like you said in your conversation with him, it's quite obvious that the signal that the public is taking from the way the data is being presented and the way the narrative is being formed around that data is that we are in the clear, when the evidence does not actually suggest that. Our testing numbers being low, for example, is not just a question of us not testing as much as we were before. It's a question of whether we are testing enough to meet a standard. And the WHO has set that standard being that on a daily basis when we test, if we are consistently above 5%, then we are not testing enough. And there haven't been days, I don't think there's been more than 3 days since June 1, actually since May 15th, where we have actually been below that 5% threshold. So we know that's a chronic problem where we are not meeting the basic standard for being able to know that we have the epidemic contained. So when you see that as a known factor, and then you see a decline in the amount of tests we're doing, it's obviously a little bit concerning. That's why I wanted to get clarity there. I'm not sure we really got a clear answer there. What we heard was that, okay, we're not testing as much as we were before because the pool testing efficiencies that we're relying on have been kind of eroded by the higher positivity rates. Again, that's something that was pointed out when pool testing was being floated in March and April. So the point of that was supposed to use that technique as a bridge, and then to expand our lab capacity by bringing on our Gene Express machines and the other kinds of diagnostic options we had available to us. And the fact that we are back to a situation where, because positivity rates are higher, we are seeing such a steep decline in testing means that we actually didn't use that time properly to effectively scale up the testing. And the second question I asked had to do with whether or not we were the way we are managing the data, because of what it does to risk perception and risk awareness. it's, you know, I picked up a few notes on what he said about the management of the COVID-19 deaths. And I really wanted us to get clarity on that, because if you recall, much of the rationale around easing, the course of easing since the lockdown has been that people aren't dying as much. But and I think that's a true thing for all of Africa as a fact. But I do think that's important that we have an accurate picture of what that really means in Ghana. And in this case, we found out about a review process that, you know, most people hadn't heard about until Manasseh Azura's article, where deaths out of care are being reviewed, so that, if I'm using some of the language Dr. Sidi Bekoin used, that we are convinced that they are COVID-19 deaths. But what we know, obviously, from a viral infection is that when people get a deadly virus, the virus is never what kills them. That's not how that works. The viruses cause other complications or responses in the body that then go on to create life-threatening circumstances that can lead to death. So it's like with HIV. We know that the HIV virus itself is not what kills people, but it's the fact that it makes people vulnerable to other infections that then they tend to die of. So the distinction we're making here between, like I say, death from COVID and death with COVID, it seems to be a distinction without a difference. So if that's being used as a premise for saying this is a COVID death versus not a COVID death, when the person is a confirmed COVID-19 case, then obviously you can see how there'll be some, we'll be skewing the data a little bit when it comes to COVID-19 deaths. And all that stuff is important because we should be making decisions based on facts that we have in hand, that we know are credible facts. It seems a little bit problematic when we know that there are, there's a backlog of fatalities, to be using that as a rationale for some of the decisions we're making. And importantly there, I think it also speaks to an issue that we've had with some of the data coming out of the Ghana Health Service, which is the consistency. It shouldn't be the case that we are operating on assumptions that get changed without any clarification. And that's important because I think even third-party individuals who are doing the analysis need to know when there are such substantive changes in the way we are describing variables or the way we are doing testing, so that they are not making wrong analysis, so that especially if we are seeing improvements, we are not here delaying actions that can make the economy bounce back quicker just because we're not operating the data well, or that people are coming up with a false impression of it because of the changes in the variables. So it's not just for the benefit of the people who are observing the data, it's also for the benefit of the Ghana Health Service and our COVID-19 managers as well, so that we're all operating on a basis of common facts, on a basis of common realities, so then the analyses at least can be differences in interpretations, but not differences in realities. And that's what I think I wanted to point out there.
All right. Thank you very much, Nana. So I would want to take the conversation or bring in Teiko Sarbah here. Teiko Sarbah, you have done something incredible when it comes to the real cost of the pandemic. And I'm talking about the economic and the social cost of this pandemic. Star Ghana, I understand, has done some work on that. I want you to situate this conversation in context, because that is why I believe it's from that premise that we can go on to have this conversation about whether we should take the prescriptions like Senka. So Teiko, you tell us, what have been your observations as far as the real cost, social and economic cost this pandemic have been? Because for us, looking at it, actually, we can say that lots of people have lost their jobs. Lots of businesses have shut down right here in Ghana. Elsewhere in the West, if you lose your job, you're going to get unemployment benefit in Ghana or not. So you tell us what your observations are, Teiko.
Thank you very much, Israel, and thank you to all your guests and also those who are joining us online. When the pandemic broke out in Ghana in March, we were to a large extent unprepared for it. And we were also not prepared for the the scale that the pandemic has taken to date. But I think that so far we have done well. Civil society in itself have done a lot of research to try to understand the changing nature of the pandemic and also how it affects us. You would know that when the pandemic started, we thought it was just a health issue and would be sorted out in a few days, then a few weeks, then a few months, and now it looks like it will be with us for a while. And so civil society sought to understand why this is happening and what is happening and how we can take it forward. Now, if you take an example of a research that one of our partners did, a civil society platform on the SDGs, looking at the impact of the presidential initiatives on citizens, it found that because not all Ghanaians have electricity or even have their own electric meters, it's not everybody who has benefited from the 3-month subsidy that the president brought on board. Similar with water. If you look at information flow, for example, most Ghanaians, at least the research that we did, show that they got their information from the president's addresses, which happens every 2 weeks. That is where they got their information from. We also did some research on how this has affected children with disabilities. And I would say that our sampling size was quite small. It was based in Accra. It was based in some of the slums in Accra. And what you found was that most children who had disabilities that were supposed to be in school were not in school, of course, but they were also not able to access the online systems that had been set up by the schools because they just did not have the support facilities to do that. And we actually found that just 1 out of 71 parents had access to online facilities to support their children. This is important. Now, if you look at the socioeconomic impacts, let me give you an example of, and I'll take it from a sectoral approach. Education sector, most children are home. In fact, all children are home. Now, because of that, it's not just the schools, the private schools that are suffering, the teachers that are home who are on half pay, but also the value chain infrastructure around children in schools. For example, there was a whole economy of taxi drivers who pick children from home, take them to school and bring them back, and then they charge their parents on a monthly basis. Now that economy is bust, there's no money there. There were people who sold books to children in school, and we know how our children go through books. There are people who sold school uniforms to children in schools, and all this system has broken down. Now, because of that, families are not able to take care of themselves. We did NetRight, which is also a partner to Star Ghana, but this they did in their own capacity, also did a research on how this has affected Ghanaian women, and therefore how Ghanaian women can revise or revive and make their lives better because of that. One of the things that they looked at was the coronavirus alleviation program, which was set up by the government of Ghana to support small businesses. And you recognize that they came out with a call for proposals to get small businesses to put in applications so that they could be supported. Now, one of the criteria for support was that the small businesses should have between 1 to 99 employees. And you would notice that for women in the informal sector in Ghana, they are what we call own account businesses. The woman is the employee. The woman is the manager, she's the worker, she's the cleaner. And therefore, if you give a coronavirus alleviation program for small businesses between 1 and 99, those businesses that are just a woman, how does she take advantage of that? We know that one of the issues for that program itself was also that everybody should have a TIN, T-I-N, before they can access that grant. I would ask once again, how many of our fishmongers in the Jamestown market or in Kpong, where I come from, have 10 numbers and therefore are able to access those those grants. These are issues that I believe that were not looked at, and it's affecting small businesses and it's affecting citizens in Ghana in terms of how they are able to survive. Let's go further and look at persons with disabilities. And you'd recognize that persons with disabilities themselves have their own peculiar needs. For example, persons with albinism, they have autoimmune system challenges, and therefore they have specific medications that they take. What you find is that because of this coronavirus, they are unable to access the hospitals, they are unable to access their medications, and in many instances, there's a lot of stigma that comes to them because people do not recognize their situation and therefore the medications that they take, and that helps us. Now I want to look at the legal implications. What did the restrictions do to our socioeconomic situation in Ghana? And as you know, Act 1012, which was the Imposition of Restrictions Act, was passed in March. Now, what this did was to restrict access to many things. And we know that even though those restrictions have been drastically relaxed, there continue to be challenges for assessing what we were able to assess in the past. And this affects some other businesses that we have. And of course, there's been a lot of conversation around the tourism sector, but you know that the tourism sector is not just the big hotels, but it's also an ecosystem of vendors and service providers around the tourism and the service provision sector. That includes DJs, that includes souvenirs, that includes food processors, that includes women, that includes cleaners and washers and decorators that have been affected by the Restrictions Act. Now, if you look at civil society, for example, civil society thrives on assembling. Civil society thrives on campaigns. Now there's a ban on holding campaigns. You cannot meet if you are more than 100 people. What does this mean for the work that civil society is doing? We need to look at how to make it different. So coronavirus in itself, I think the effects are cross-cutting, but there have been some gains. Some people have actually benefited from this sector. And we can look at that as we go ahead. But we know that, for example, the transportation industry, the Okada drivers, the delivery vans have actually benefited, and they are doing well because people are staying at home and ordering for more things online. Online businesses have benefited because they're able to expand their reach. Telcos have benefited. And one other sector that has benefited is the pharmaceutical sector, because even though people cannot go to hospitals, they do go to pharmacies to get medication. And therefore, the pharmaceutical sector has benefited from this coronavirus.
Regarding the pharmaceutical sector, though, I engaged one pharmaceutical company or retailer who indicated that it's not quite the way you think. Because see, people, it's not just about the people who walk into pharmacies to buy medication because they can't go to the hospital or they're refusing to go to the hospital. It's also about hospitals buying from them. And if hospitals are not buying from them because people are not coming to them, then they find themselves in quite a lurch. I want to move to Dr. Daniel Fellow, as I indicated or introduced him earlier. He describes himself as a student of life. So Dr. Fellow, you've heard all that has been said, and I'm sure you've observed what has been happening in the country in the last 7 months. What is your take on how we have managed the situation?
Thank you very much. And good day to my colleagues on the line. Like you said, I'm a student and still trying to understand. But what I'm looking at critically is how we are managing what has confronted us. If you ask me, and I want to be honest with you, and I want to provoke you, then I will say disruption is good. Because we can complain 1001, COVID is here. COVID is not going anywhere. Just like malaria is with us and it's not going. but you do not get malaria on a daily basis because you've come to understand what malaria is and you manage yourself properly. A lot of the things we are complaining about are issues that ordinarily we should have looked at and tried to improve previously. Now, if you take, let's say, Accra, there's so much traffic in Accra. We should have thought of improving traffic. But COVID has come to help us to reduce the traffic. And for me, there are lessons to learn from that. It means a lot of the things we were doing previously were absolutely unnecessary. Because if you see look, yeah, every morning people do not less than 2 hours to get to the office on the high street, 2 hours to get back. Now, they are being told you can work from home. Where did this come from? If it hadn't been for COVID, we won't be pushed to think, isn't it?
So are we getting the same levels of efficiency?
You can get the same level of efficiency. I do a lot of my board meetings these days online, and we get the same level of efficiency. So there's something we need to learn about these things. What our issue is that we have limited resources, and we need to manage that limited resources very well and try to be efficient in all the things we do. But we're not doing that. But COVID is throwing something at us. God has been good to us. You see that our death rate, at least from the numbers I see, is relatively low. So there is something positive about that. We may not be testing so many cases, but how do we manage the resources we have? And if we are learning, probably we should be learning from China. This whole thing started from China. They were #1. I just checked. Now they are number 33. So what is it that they are doing right and that we are not learning? There's a chain. We need to break the chain. I mean, if you go to the traditional business school, they teach you of this phenomenon of bushfire. If the bushfire is coming, what do? What you do is you run ahead of it, clear some land, and create a break. So once the fire gets to the break, it stops. And that is how we need to be thinking to break this chain.
I'd like to focus on that a bit. So in this case, which of the bushfire or which of the bushes are you suggesting that we clear?
So what is it that we need? Look, this is a very small country, limited resources, still struggling with revenue. So we should be thinking of how do we protect the productive sector? How do we shift resources to those areas and make sure those people's health needs are well taken care of, that they remain productive whilst we work on the others? Because we must continue to be generating the revenue whilst we try to resolve the other issues. But we seem to have shifted to, come on, free for all. Let's share the little that we have. Let's borrow money, do this, do that. But how to generate the revenue, we've neglected. The taxi driver could be complaining, but this is time for the taxi driver to also rethink. The children are not being carried from home to school on a daily basis, but that has also reduced the traffic in Accra. And the fuel that we waste, we are now saving. Of course, even though that would affect government tax revenue, it is time for us all to rethink what is happening to us. Without the rethinking, we'll waste a lot more resources than before. So my concern as a student of life is, let us pause. Let's put everything on the table and talk about how to shift them and create a new balance that makes it a lot more efficient than what it is. The testing issues will still be with us. I do not believe that we have an efficient system of collecting records and to be reporting. We all know that. But we are individuals who are hurting. But what we need is leadership to reshape us, to redirect us, to help us think the new way of doing things and make us very competitive. My take is, look, if we are thinking hard enough, we should be doing something to share with the rest of the world, probably. Concentrate a lot more on our agri system to be able to export to the rest of the world and make money and tell ourselves COVID has taught us something. Probably this is the time to push a lot more young people into technology to develop their skills and be able to do work efficiently.
Doug, how do we get to do all of that? Essentially, what you're suggesting is we open up the economy and go about our business. How do we get to do all of that without risking more lives? And I'll come to you later to hear what you have to say about that. I want to go to Nana Kofi Quakyi right now. Nana, you've heard what Dr. Settle has had to say. Dr. Settle is not a medical doctor, by the way. He is a doctor of books, and he calls himself a student of life, even though I believe he knows so much already. Now, Nana Kofi, you've heard what Dr. Settle has had to say. Is there a way we can still go about life without risking too many lives? Because he suggests that let's figure out a way, open up and continue to go about our lives or learn from what COVID is doing to our economy, to us, into our society, and rather adapt. What do you have to say about that?
Well, I think that's what we talk about when we talk about the new normal. That's really the set of circumstances we are looking for. A scenario where we can restore as much economic and productive activity as we can, while making sure that in parallel, we are keeping infections as low as possible. I think of this stuff often as kind of a risk budget, right? So we understand that in Ghana, by the virtue of our limited resources, we can take certain kinds of risks, both in terms of stifling the economy and then limiting the disease. But we can't do all of them at the same time because we have to survive, but we also keep the disease down. So the risk budget, I think of it as basically, it's okay, you have your testing capacity, you have your contact tracing capacity, and as far as you're operating beneath those limits, then you can keep your economic activity going, because you know that if you have cases, you have the capacity to test and identify them, you have the capacity to trace and isolate potential contacts. So you have the means to actually contain the spread if you should have an upsurge. So your risk budget is the amount of leeway you can give in the economy where that can still be true, where you can still do the response. And so there, the one way to really get to that point is by expanding the capacity to test and trace. If you expand it wide enough where it can be efficient and effective, then you can take more risks with opening the economy, knowing that you can contain the consequences a little better. And the other way to do it is by limiting the risks you are taking so that you can stay within the limited budget you have. So rather than saying we're going to open schools and churches and workplaces all at the same time, we're going to prioritize and say, okay, we're going to focus on productive activities, risk associated with productive activities. So we'll go back to the markets, and we might go back to schools, but we won't open churches, or we won't be having large political gatherings or large funerals. That's managing that risk budget so we can actually contain the spread. Because ultimately, you know, we don't exist in a vacuum. Our economy is not siloed off from the rest of the world, and how they perceive our performance here impacts things like whether or not, you know, Ghana will be put on, you know, green zone lists where they are considered countries that are safe to travel to. Those are the kind of things that also directly impact the economy. If we can't get people coming in, if we can't get foreign travel effective, because for example, British Airways isn't going to fly a plane of British people to Ghana and then fly the plane back empty because Ghanaians aren't allowed, or Ghana isn't clear for arrivals in other countries. So what we do here with respect to infection control, that really is the game in terms of making sure that we can unlock other opportunities in the economy, in social welfare, so we can restore dignity, save livelihoods, and also save lives. Because like what we're seeing here is that if we are going solely by, you know, the confirmed deaths, for example, to say that the cost has been relatively low, well, the same limitations that make it so that we have limited testing capacity and limited ICU capacity also means so that we have limited surveillance capacity for deaths and for illnesses. So what we are picking up, as with the cases themselves, is just the tip of the iceberg. So what we should, I think we have to be cautious about what we think we know and put that in the context of the limitations we have to know those things.
But I'll come to you, Teiko. So you've heard some of the suggestions or some of the benefits. In fact, you had gone ahead to talk about some of the benefits. Doctor said obviously that can we look at some of these things and try and get the most out of the situation?
Definitely, yes, we need to. In social policy development, positive disruption is actually important. And you see that as what brought the first industrial revolution, the second industrial revolution, and now we are in the fourth industrial revolution, because there's always disruption to our way of life and what we have always known and taken for granted. And it's only when that disruption is recognized and seen in a positive light that it becomes a catalyst for change in any society at all. So I totally agree that COVID is also an opportunity given to citizens of the world, to be able to look at things differently. We have been in a rat race for a very long time. And this might be the opportunity for us to take a step back and reflect on our lives to see what we can do. I mean, most borders have been closed for the past 6 months, but business is still going on. The statistics in Africa show that even though there has been no flight for a very long time, if I give an example of tea exports from Kenya is still at the levels that it was pre-COVID times. So we can still do things, but we have to do it in a different way. And human beings as ourselves must reinvent ourselves. We must be agile. Agile in leadership, and Dr. Sedo spoke about that. Our leadership itself must be agile. What are the key things that are of importance to us, and therefore what should we take forward? Citizens ourselves must also change the way we look at things. And between this, we see this as the new social contract. A new social contract meaning that we have to look at things differently. Of course, the state will still be the demand side, the supply side, citizens will be the demand side. But now the tools and the techniques that we use to look at how we are engaging and how we are working has to change. And I gave the example of the taxi drivers. Yes, the taxi drivers have to also evolve. Otherwise, we are like the dinosaurs. You either adapt or die. And that is what will happen to a lot of businesses who do not see this as a positive trend. And therefore, they are waiting for business to go back to the way it was post 16th March 2020 in Ghana here. And I know that it would not be that way, even if COVID goes away, because we have learned new ways of doing things. You would see the data. For example, Facebook now are saying that Google actually are saying that they would not have employees in the office until 2021. And they are working from home, and it's working well. We have seen trend analysis that shows that real estate, especially around offices, would be a business that would not thrive because most employers have realized that working from home actually is profitable for them because they do not have to buy, water for employees when they're in the office. Stationery has gone down, everything has gone down. So this is the new normal. And these are the things that we have to look at. And as a Pan-Africanist, I'll bring it to the African continent and say, this is a space for us as Africans to use to re-engage. In the past, what has brought us together was the fight against colonialism. And around that, you could see how the African Union rallied its members and ensured that each and every single African country was released from colonialism. And that worked very well. This gives us another opportunity for the African continent to come together to say that how do we support each other? Yes, the borders might be closed, but we have the African Continental Free Trade Agreement, which is ensuring that goods and persons are able to flow across borders. Now we know that goods are flowing. And I would like to commend the work that Ethiopia has done in terms of sharing PPEs that came from, yes, it initially came from Jack Ma, but we know that other countries are now also providing PPEs. And the role of, if you look, the Ethiopian Airlines, in terms of ensuring that each and every African country has the resources, they are flying to all other countries and providing these resources that are important for African countries to be able to ensure that we overcome this pandemic. I think, yes, this is an opportunity for us to be able to re-engage. This is an opportunity for Africa to think differently, to be agile, and to ensure that we have a new social contract that is Pan-African, that focuses on Africa, and that focuses on what we can do for each other, 55 African countries together. And I think that by doing that, by taking the institutions that exist that are working, we are able to do it. Let me give you another example of the African Development Bank. The African Development Bank, as the main agency for economic transformation in Africa, has been put at the back burner for many, many years. Now it's taking a stronger role in agriculture. It's taking a stronger role to ensure that countries have access to the funds that they need to be able to deliver services to its people. And I believe that these are some of the ways that we can do to move forward, Israel.
All right. Nana Kofi Quakyi, the PS, has joined us back. Now, Nana Kofi Quakyi, before you lost your position, the conversation came up, we were making the point that one of the ways we're going to be affected is that people are not be able to fly out or fly into Ghana because we can't find ourselves in as one of the countries that is safe to travel to. But the point I'm also making is there are those who say, why should we worry about not being able to fly out or have people come in? As Teiko is saying, why don't we look within ourselves and trade amongst ourselves across our borders rather than worry about people flying out and flying?
Well, I mean, when I said that, I was referring specifically to Ghana. And naturally, when I'm talking about these other countries, I'm talking about countries like Rwanda or Kenya that do have lists of countries they will allow in. Rwanda, for example, I think they had initially 11 countries. They had another 5. And Ghana is not one of those countries. So it would apply as well to a flight coming from Kenya Airways coming from Kigali. I bring passengers, but we'll have to go back empty if it was going to Nairobi or Kigali. So I'm not just talking about like trade between Ghana and European nations. I'm talking about trade between Ghana and other nations, even in Africa. That's affected a little bit there. But I do tend to agree. I'm also a health economist, so I look at it not just in terms of what the health risks are, but what does it do at a systems level and our ability to finance and support other critical sectors of the economy. And obviously, the end goal is to make sure that we can return to some version of normality, not what we had before the 12th, but some version. And we're just trying to do that in a way where we can make sure we are limiting the risk to people's lives and then to people's health. And those risks coming from directly having severe infections from COVID or dying from it, or having long-term complications, even if they had mild infections. Those are what we are trying to avoid here. But the goal obviously is not to deal with COVID perpetually, it's to contain COVID so we can return or begin a return to some form of normality. And obviously there, I think even with the response to COVID-19, some of the best ideas we've seen in terms of solving issues like testing, issues like data surveillance, have come from collective proposals. For example, at the Africa CDC, where they are trying to convince African countries to pool resources for procurement, for testing reagents, for pipettes, and all the supplies and supply chain items they need to keep their testing going. Because if we go to the market as a collective, we have better bargaining power, we are better able to ensure that there is less waste at a local level, and we're able to get more bang for our buck. Those kind of collaborative efforts are critical if we're going to actually be effective here. And those are the kinds of things where, especially if we are conceding that we can't take the pain of some of the limitations and restrictions, those are the areas where by concerted, continental, or at least regional action, we can make sure that we can expand that risk budget I was talking about to make sure that even as we are reopening, we have more capacity to deal with the consequences of new infections and other transmission and community spread, which are inevitable in that case. That's what the goal is. So we're just trying to make sure we are getting there safely, where safely is defined as being able to identify cases, test and trace and isolate effectively and treat. And where so much of what makes individual countries more capable of doing that can be enhanced by greater regional cooperation. I think there's no doubt about that.
All right. Nana, I want to ask you this question. What do you make? Are you convinced about what we are doing as a country as far as containing COVID-19 is concerned?
Well, again, I look at it in terms of like the simple logic of what happens in an epidemic, right? The first thing that determines whether or not infections happen is A, whether or not you have virus in circulation, and B, whether or not people are acting in a way that protects them and other people from getting the virus that's in circulation. So if you have a high amount of virus in circulation, then you want to see behavioral adaptations that are responsive to that. Dr. Teiko Sarbah mentioned that we are just now beginning to include that measurement of compliance in our data. That's something that frankly should have been happening right from the beginning, because that's what determines the likelihood of infections. And then once those infections happen, we are dealing then with how well we manage them. Are we tracing all their contacts? Are we making sure we have capacity to treat all of them? We reached points in this epidemic where if it wasn't for the redefinition of recoveries and discharges, we would have had a significant backlog in our facilities. So we know that we have that some of the progress that we're seeing has been made possible by not necessarily substantive changes, but by definition changes that make it possible to redefine certain dates in certain ways. So we should be cautious about that. But I think obviously the WHO has said this, public health people continue to say this. There is no world in which we can say we have an infection under control if we are testing below what our test positivity rate says we should be testing. There's just no world in which that's possible. So if we are not focusing our attention on making sure that our testing is not just about people showing up at hospitals, but on some extent detecting asymptomatic cases to some extent and containing their contacts as well, we will continue to have virus in circulation. We will continue to have rising infections. And if we, as part of our easing measures, just start limiting testing to meet, as Dr. Teiko Sarbah described it, the X number for the number of cases they are picking. If we are just modulating or regulating testing to maintain that number, obviously we are going to be missing more and more cases. So there's no version of our ability to move forward where we are not solving those problems. And I'm not fully convinced that we are testing enough, for example, to know that. I'm not convinced that we are tracing enough to know that. And in the ways that we are relating the information, I'm not convinced that there's always complete candor in exactly where we are, so that we have an accurate and realistic view of what options exist for us.
Right. So you have indicated that you're not convinced about what we are doing and how effectively we are controlling or containing this pandemic. Now, knowing that, I want to ask you, it doesn't appear as if we haven't done that so far, we've not been able to convince you so far, and it doesn't appear that we will be able to convince you. Would you then say that we may as well abandon whatever we're trying to do? Because if we don't do it effectively, we may as well forget about it. So as a health economist, I'm putting this question to you, that if we don't have COVID-19 impacting us as significantly as it has other countries, why don't we just forget about everything else and let us live our lives so that we can at least win one way or somehow. So we may not win on the COVID front, but we could win economically.
I guess there's where, like ethics and governance comes in, right? It's a question of what is the cost of saying that if we can't do it effectively, then let's not do it at all. What that means is that you will have an uncontrolled spread, so that even if the percentage of people who need hospitals is low, or the percentage of people who might die is low, the sheer number of people who get infected means that the raw numbers of those two categories will also be high. And that is a scenario that we have to ask ourselves whether we can morally accept. Can we accept a situation where we might end up like South Africa, where they have 500,000 COVID-19 cases? What would that look like in terms of fatalities for us? That would be a couple of thousand people dead. Is that something that we are saying is an acceptable trade-off to get to move on and attempt to rescue the economy? And for the thing, because it's a novel virus and there's so much we don't know about the long-term consequences and about the long-term health effects, and what pressures those will put on our healthcare system, on our labor force in 10 years and 15 years for people who survive. It just seems like both a morally unacceptable route to follow and a rationally, incomplete logic to make, because we don't know all the things we think we know, especially because we can't know it this early in a pandemic where we're still learning about the disease. So when I say I'm not convinced, I'm not saying that we're not doing anything right. That's not what I'm saying. But I'm saying that the critical measures that we need to look at to know that we can make the adjustments for the economy and for livelihoods safely, we are not hitting those marks. We're not hitting those marks on testing. We're not hitting those marks on positivity. And we know that it's doable because there are other African countries who are doing it. We're seeing Rwanda making gains where they're seeing lower number of cases, testing more and more on a daily basis. So we know that there are countries that are doing it right here in Africa. We're not talking about comparisons to the West. And we have to go and look at how they are getting their public health crisis contained, and therefore why they're able to expand. They have more options open to them in terms of safeguarding the economy and livelihoods.
All right. I want to ask put the same question to you, Dr. Sedo. You are leaning more on we saving the economy. So, but another question is raising issues of morals here. Should we, as you indicated earlier, clear a part of the bush during this bushfire so that essentially sacrifice that part of the bush so that the rest of the bush will be saved, or the economy will be saved in this regard?
Thank you very much. My issue is not about opening the economy at the expense of anything, but my issue is about saving the human race. And I have the conviction that we can find a way to go about this thing easily. In as much as we know that there is no cure, there is one thing we know, which is if you protect yourself, if you wear the mask, if you wash your hands, you'll be fine. So I would have loved to see the situation where mask is even being distributed freely on daily basis, and people more or less are compelled to wear masks. Again, I spoke about our productive sector. I would love to see somebody making conscious effort to go to, let's say, the cocoa growing areas, educate these guys very well, provide them with masks, make sure there's running water, there is soap. These are basic things that they follow those protocols, and we are sure that we have protected them. So it means that we have cleared that forest there. So the thing, when it moves to those areas, they are already protected. Yes, government has given free water, some electricity, fantastic decision. But again, we could push it a little further by saying that those who are being given free electricity, if we encourage and set up some small solar system, because we have excess sunshine, that could be a lot more efficient than what it is. And even the water, assuming we put that money together and say Ghana Water set up a plant, let's say Asugakope, where water is wasted on daily basis, pump a lot more water into other areas, export a lot more. Probably when we do the numbers, that could also be a lot more efficient. So indeed, there are things we can do if we look hard, because what we are seeing, this country, we depend a lot more on foreign investment. Those investments are not likely to come. We seem to be borrowing, but we are not generating any activity to put us even in a position to pay for those borrowings. We seem to be running a system that is not productive currently. So all that I'm saying is that in as much as we are worried about COVID, Let's find a way of preserving everybody else by doing the basic things. Let's push it so hard that once I step out, my mask is on, I have a sanitizer, I have running water. Once I get back, I need to wash my hands. My diet is looked after properly, then I know I'm good. But in the workplace, cost of doing things reduce. Efficiency is introduced. Even if I'm working from home, the internet is stable. You had my colleague's line went off at a certain point. Probably as part of the challenges that we still do have. How do we improve that if we want to have this conversation, there will be no interruption? If I need to get work done and send out reports, there will be no interruptions. If I need to do my meetings, there will be no interruptions. So for me, we can still kickstart the economy in a brilliant way, and we can still control COVID if we meant to do so. I don't see any real difficulty in this at all.
Teiko, I want to also ask you, what would be your prescriptions or solutions to containing this pandemic?
Okay. I think that generally we still have a very positive outlook as Africans. And there was a research done which showed that about 75% of African youth still thought that even within the COVID era, there is still a lot of innovation that could happen and that the future looked bright. So I will build on this optimism and say that this is the opportunity for us to rethink what we want to do with ourselves, as Dr. Sedo is saying. First things first is that all the other things that Africans grapple with continue to exist. So malaria is still there, even though malaria now would be very unhappy with us because nobody's minding it as much as they used to do in the past. Maternal mortalities are still high. And now we even project that it might be higher because women who are pregnant are afraid to go to hospitals. And women who have to go for family planning do not go. So we will also get increased number of births. So there are many things, social issues that continue to exist and persist that we need to address in conjunction with this new COVID pandemic. We should not focus only on COVID to the exclusion of all the other things that are important to Africans and of course Ghanaians. This includes education, includes healthcare, includes economy, includes life skills, and all the things that we continue to do. But we need to do it in a different way. And our African leaders need to be agile to be able to do that. Two things. The Africa Union's Agenda 2063 continues to exist, and this is looking at a prosperous Africa. Now, how do we do that within a COVID framework? And I think this is something that we can look at and work on. You can see that the leaders themselves are already coming together and they are doing new things. We had an ECOWAS summit that was online. Hallelujah. I had never seen that before. African Union, they are talking to leaders online. I think that can continue. The SDGs is also something that we need to continue to look at all the goals from Goal 1 poverty to Goal 17, which is looking at partnerships. How do we make these work in a new way? And I think these are the things that we need to look at. But the new norm is here. And we have to find ways to reflect that. So one, it begins with the individual ourselves, as Dr. Sedo said, wash your hands, wear your mask, but also institutionally that we need to see our leaders leading in a way that gives us trust in their attitudes and in the ways that we continue to learn about this pandemic and juxtaposing it with all the other issues that we have to work with, ensuring that we are able to build our own systems and increase wealth in ways that help us to sustain it. Otherwise, we become a house of cards, which can collapse on in itself. We have to learn the lessons from Ebola. And I think this is where Africa is actually in the lead. That Ebola has been with us for a while. We have learned the lessons. That's why we have the Africa CDC. And learning the lessons from Ebola means that we have to look at the cultural as well as the social and the economic. And the cultural might be the way to go. Have we looked at that? That is where I would want to leave us, that as we tackle this, looking at a scientific way, looking for an economic solution and a social solution, we should not forget the cultural solution that underpins Africa's development and holds us together. Israel, over to you.
Yes, and to Nana now, one of the areas that has been, sectors that have been severely affected has to do with education. To the extent that we're having millions of school children who have been home for months. I'm beginning to wonder and ask myself, at what point do we let the kids go back to school? Because other countries, yes, everybody else is saying that if you're looking at Africa-specific prescriptions, everywhere else the suggestion is let's still keep the kids in school. Can we take a different route and decide that, well, we can let the kids go back to school under certain conditions? Nana.
Yeah, like everything I've said, it's exactly that. We can't let the kids go back to school, but under certain conditions. And the question is, what are those conditions? These should be conditions in which we are minimizing the risk as much as possible. So where we are making sure that students have masks, that we have running water facilities, that we have all those resources available. And we need to make sure that there is clear understanding at the different institutions about what they should do if they should have a case. We shouldn't have like what happened when the final years were back in school, where faculty at the school were worried that a student had COVID, so they just left a sick student and the student passed. That's the kind of stuff that we should have clarity on. What are the expectations? What are the things we're supposed to do? Because again, the cost of students staying at home in Africa, quite honestly, is much higher than it is pretty much anywhere else in the world. We know that the resources to actually access remote learning tools are A, limited, and B, that online learning process also really ingrains a lot of existing inequalities, because the students who are least able to access them effectively are the students who also typically would need that kind of continuous in-class learning the most, because they are least likely to have home support. So we have to deal with those. We have to be conscious of those inequalities and consider those inequities. So as for getting the students back to school, I think that has to be an absolute priority. But the question is, how can we do it in a way where we know that we're not going to suffer adverse consequences? We want to make sure that we know that, okay, if there are outbreaks, especially at the boarding schools, we have effective ways to deal with those in a way that also allows families to be calm and be cooperative, rather than massing at schools and having all that drama. But we also should be thinking about this in a strategic way, obviously. We should be thinking about our local context and how we deal with this. So I look at some of the data we have at regional infection rates. It's quite obvious that in the northern region, for example, or in the Bono region, we haven't had the same scale of an outbreak as you've had in Accra or in Kumasi or Greater Accra and Ashanti region. So we can take regional approaches to making sure that we are limiting the harm from having kids stay home or whatnot. And especially, or we can look at areas where we know that where we know there's especially high deprivation, or the inequality gradient is the highest, and focus on those areas and take more risk there in terms of sending kids back to school, and be more conservative when it comes to maybe schools in Accra and Kumasi. So we have to just be critical and think, about our contextual factors. It's not a question of saying, American schools are staying home, so we stay home. We can't afford to do that. But we have to think about the local context. We have to look at the reality of what the data tells us, and then we have to make a decision about what kind of risk we are prepared to tolerate and what kind of risk is more or less acceptable in that context, and then take the necessary actions.
How long do you think we should keep the kids in school? Keep the kids at home before we allow them back? Because as you already indicated, there's a whole economy around schools being open, or schools being in session. You're talking about the printers who print the books, and the taxi drivers who have to send these kids to school. How long can we continue to have them being at home?
Okay, I think we should not pick a date out of thin air, and come up with a time, but let us let the science lead us. I believe that now we are sort of working with a pilot basis where the seniors are in school now. How has that worked out? And then we can roll it out on a gradual basis to other children who are a little bit older and therefore able to be more responsible. And then we can find a way to reflect and review what is happening. We might look at a hybrid system where we are mixing the online with the face-to-face. And I note the challenges that Nana has spoken about, the inequalities that it deepens, because it's not everybody who even has electricity to use online systems or can afford the appliances that are using it. There's also a challenge for girls who are now home, because it opens them up to many, many issues of domestic violence, sexual abuse, child pregnancy, and all the things that, are available because children are in a situation and they've been in that situation for the past 8 months. So I would not pick a date out of thin air. I would say that let the science lead us. Let us look at it from a day-to-day basis. We would not, as Nana said, not because America is doing it and therefore we are doing it as well. We have to look at Africa-led solutions, which might involve a hybrid, which might involve other methods. And I'm seeing, for example, the Ministry of Education is even giving homework in the schools and enabling parents to pick up the homework, take it home for their children to do it, and then return it to the school. So let's be innovative. Once again, as Dr. Sedo said, this is the opportunity for us to be innovative. Look at a different way of doing learning for our children, which includes online, face-to-face, and other methods. So I would not go for a particular date. And the other economy, they would have to also adapt, because that is the way. Otherwise, they would die. Yeah.
All right, Teiko. So, Dr. Sedo, I'd like you to come in here. What would you say should be the way forward as far as the conversation we're having today is concerned? And then we're would have to be rounding off a moment now. So
Yeah,
let's go with you. Your final
take
way
to
forward.
the educational side. I mean, if we were to be paying attention, you see that education has started changing long ago. You have semesters introduced, you have online, people doing weekend school, and all kinds of things. The question I want to ask is very simple. How much are we spending on free SHS? And how much do we spend per child? Then I come back to ask, what is the cost of one television set? That if we buy television sets for homes and put the learning materials on the TV screens instead of those other things they watch, wouldn't that serve us better? Where the reception is a bit low, we find a way of increasing it. So it doesn't matter where they are, they can still get education. Because truly, everything has changed. The earlier we get into the change and start doing things, the better it will be for us. Look at a situation where you take a village, put TV sets in their homes, encourage them to use the mask, wash their hands, improve health, the sanitary conditions, improve that. If they do that, we'll see a lot of progress. The children will be learning on a daily basis on the TV. And that will solve our problem. Indeed, for me, COVID is a good thing. If we choose to pick the lessons and work hard at them, and with all apologies, eliminate the politics, African politics, eliminate it, and confront it as hardcore issues, make the hard decision, make the changes we need to make. The lady talked about culture. It's a significant thing we need to work on. Our belief system, significant things we need to work on. If we can address all those things, certainly our lives could be better even after COVID.
Right. Yeah. So Nana Kofi, what will be your final thoughts on the way forward?
Well, again, anytime I have a chance like this, I want to always emphasize that the most cogent, most reliable way forward is to make sure that we are taking the individual risk precautions seriously. That means hand washing, mask wearing, and doing all the things we're supposed to do. And with the mask wearing, I think it's important we understand that it's really such a critical game changer when there's high compliance. And we also need to understand why we really are wearing them. It's not just a question, it's not really actually a question of protecting yourself. If you're in a room with somebody who is not wearing a mask and is coughing, you are only slightly less vulnerable than you were wearing the mask. But if the person who is coughing is wearing a mask, we are significantly protected. The main aim is to protect other people from ourselves if we should have COVID-19 asymptomatically and not know. That's really why we wear masks. So it's important that that's why compliance matters. That's why it's important we frame things appropriately. And again, the game here is about innovation, making sure that we are speaking to our local context. With the culture aspect, for example, the public health, so much of the public health response, if it was better ingrained in cultural contextualization and social understanding of people's belief systems, we would be doing a lot better with the compliance. In areas outside of Accra, for example, what have we done to bring in traditional rulers? I can tell you that in Akropong, if the Akuapene says we are wearing masks, the town is going to wear masks, more so than if the MCE says it. So what have we done to make sure that we are taking advantage of our cultural context to get those messaging points correct, so that we can get the compliance we need to move forward? But that's really what we have to focus on as individuals, making sure that we are taking care of ourselves, following the guidelines, and also, like was just said, taking the politics out of it. Let's operate on common facts. Let's operate on common realities. Let's be led by the science and the data, and let's be candid about what it says, so we can do things safely, even when we are innovating.
All right, thank you very much, Kofi Quakyi. And that's about it. That's about all time will allow us. So I'd want to say a big thank you to all of you for making time to join us for this conversation. I must first of all also apologize for the hitches we had initially with the sound and the video at some point in time. In broadcasting, we call them technical hitches, but thankfully we were able to overcome those challenges, and we were able to bring you the show. So Nana Kofi Quakyi is a doctoral candidate, and he has a master's public health. He is at the New York University. Thank you for joining us for this conversation. Teiko Sarbah is the head of programs at the Star Ghana Foundation. And I want to use this opportunity to say thank you to Star Ghana for supporting this initiative. We are hoping that you'll be with us all to the very end. So thank you for bringing or sharing your insights with us, especially the Pan-Africanist part of you. And then to Dr. Daniel Settle, thank you very much, Dr. Daniel Settle, for also sharing your wisdom with us. You apparently have been learning some great lessons from life. Thank you for joining us for the conversation. And to those of you who joined us to watch, I say thank you to all of you. I'm very, very grateful that you made time for this. So this show, as always, is going to be made available on my YouTube channel, and I want to encourage you to get on the YouTube channel to subscribe so that when I upload new videos, you can have them. But it's going to be there. All the previous episodes are there, so you can go there and to watch. I believe we've had another interesting, insightful conversation. I'd advise that you go out there, protect yourself. For me, earlier when I spoke with Dr. Franklin Yesirubek, who also joined us, because he joined the live panel, he joined the recording. He talked about mask wearing. And I very much agree with all of you as well. If we can all decide that let's focus on the one thing that we can do so well, which could be enforcement of the wearing of face masks, I think we can really do something significant, or that one significant thing that we can do to bring the pandemic under control. So that all of you keep your mask on at any point in time, so long as you are in public. So thank you, and you have a wonderful, enjoy the rest of your Sunday.